Hello, my name is Maggie Maganga. This is a presentation of deliverable 5, and that is advanced nursing practice presentation about the grand round presentation, integration of the art and science of nursing in the decision making process. Introduction. The roles and the responsibilities of nurses differ depending on their educational level and their job positions. And according to the roles of an associate nurse will be different from those of a bachelorette, and due to the differing educational levels. Nurses with higher educational levels tend to get better job positions and also receive a better pay in their organization. Moreover, they also tend to have more knowledge and skills that are necessary in the patient care due to the higher level of education. So knowledge and skills on evidence-based practice also allows nurses to effectively handle patient needs, paving the way for effective care delivery in the setting. Therefore, educational advancement or continuing education is necessary in nursing. The presentation shall also describe the impact of graduate education on decision making and also the clinical judgment during the delivery of patient care. So, clinical judgment. Nurses encounter patients with various challenges during care delivery. Effectively attending to those challenges is necessary in an optimal care delivery. So clinical judgment is the process by which nurses make healthcare decisions based on the knowledge that they have, which includes evidence and the theories, into having the critical thinking and also clinical reasoning. The proper clinical judgment allows nurses to meet all patient needs, and in turn, this leads to a healthier outcome during the care delivery or during the stay of the patient in a particular setting. So decision making in the healthcare. So decision making is not a straightforward process in the clinical, and this we've learned through the ethics or ethical dilemmas and all that stuff. It's not always a straightforward decision. Sometimes you meet all these obstacles. So nurses examine a patient's medical history. They look at the subjective data, look at the objective data before arriving at a healthcare decision. So that means as a nurse, you have to do your assessments of both objective and subjective, and also look at the patient history. Patient's history includes their past ailments, their immunization records, and the medications that they were taking before or prior to being in the setting. Looking at the patient's medical history and all that stuff makes the nurses understand and be able to work in the progress of helping this patient over time. Significance to the nursing. Effective decision making. So effective decision making improves quality of care as nurses can make decisions that promote the health restoration. It also improves patient safety since nurses can take also improves patient safety since nurses take all factors into account, leaving little room for mistakes or negligence. That means before they make the decisions, when you're higher up in education, you get to have these small skills and knowledge on doing thorough assessment of both objective, subjective, and history of the patient, which aids in making more of beneficial decision making in the patient care. It also increases patient satisfaction since patients meet their healthcare goals at the end of the healthcare delivery process. Also, proper clinical judgment. Nurses with proper clinical judgment make good decisions in clinical care, and as a result of that, this promotes effective care and delivery. Proper clinical judgment reduces the risk of misdiagnosis. Also, during the clinical judgment, nurses use various skills and their experience to evaluate patient conditions and also needs, and doing so allows to be able to give a satisfactory care delivery. The art and the science of the nursing. The art of nursing comprises love, communication, understanding, and empathy in the caring for these patients. Nurses should show love and understanding while communicating to the patients for effective healthcare results. An example is treating a patient equally despite having different sexual orientation. So nursing field is a field where love, compassionate communication, understanding, and empathy is practiced on a day-to-day basis, which helps the patient feel loved and feel cared for, and also in the process improves the patient care. So the science of nursing mainly deals with the scientific aspect of nursing. It involves the disease process, pathophysiology, and the techniques learned during nursing education. Nurses also use these skills and knowledge to effectively cater for patient or cater to the patient needs. A good grasp of the art and science of nursing is essential to the patient care as it leads to healthier outcomes and increased patient safety. Our graduate provides nursing students with a good understanding of the two. Impact on the clinical judgment and decision making. Knowledge on the science of nursing is essential in the clinical judgment. Nurses need to understand diseases, understand how the disease processes, signs and symptoms, and also which will also make them to make accurate judgment on or the diagnosis, having the nursing diagnosis on how to help the patient in the recovery process. Nurses with mastery in the science of nurses are able to effectively examine and evaluate patient symptoms as well as manifestations. Doing so leads to better diagnosis and desired patient outcomes. Optimal care is vital in the modern day nursing. The concept involves attending to patients' mental, emotional, and physical needs. The theory of wholesome. The art of nursing promotes compassion, love, empathy in the care. With dispensing care with compassion and love according to the patient needs amounts to effective decision making, which is necessary in meeting the patient's emotional and mental needs. In turn, this allows for optimal patient care. Okay, the role of graduate education. Graduate education provides nurses with vital skills and knowledge in the patient care. The skills cover the arts and science of nursing, and accordingly, graduate nurses are better positioned as far as offering the optimal care. It also educates nursing students on the vital principles of care delivery. Adhering to these principles enhances the credibility of the patient care and improves patients' experience through care delivery. Continuing graduate education improves nurses' knowledge and experience on evidence-based practices, and deploying evidence-based practices in the patient care. 4. Also, care allow judgment and decision making. So the graduate, the higher you go up in education, the more knowledge exposure you get, and the more you build these concrete foundations in the clinical and critical judge making in the decision process when you're delivering this patient care. So impactful experience. So the author recalls a case where a middle-aged man came to their healthcare facility seeking medical guidance, and the patient seemed anxious and unwilling to talk. He appeared overweight and was sweating. The author greeted the patient with a warm smile and inquired about their name. The patient murmured back, John. Afterwards, the author inquired their name, area of residence, and hobbies. During the interaction, the author made sure to relax the patient by assuring them of the healing. After some time, the patient appeared relaxed and less anxious. It is then that the author inquired about whatever was ailing John. John opened up about suffering from hypertension and anxiety. He was seeking assistance on whether bariatric surgery would be appropriate for his condition. So as nurses, when you first walk into the patient room, usually you're a stranger to them, and it kind of makes some of them a little bit uncomfortable to open up. But how you present yourself, how you treat them, how you show empathy, love, and compassionate kind of tends to help the patient open up and be able to say or put out why they're in the healthcare facility and what is their expectation, and that kind of helps in the patient care. Application of the art and science of nursing. Art of nursing. The author treated the patient with honor and care during their meeting. Doing so relaxed the patient and made them cooperative during the care process. Moreover, the author showed interest in the patient, which calmed his anxiety and built a meaningful rapport with the author. Deploying the art of nursing allowed the author to offer compassionate care and improve compliance with the care delivery. Science of nursing. The author acquires subjective data from the patient based on their opinion. John complained of feeling like he started running away. The author interpreted the data to mean a rapid heartbeat. Afterwards, the author collected objective data via laboratory examination. The data comprised John's blood pressure, BMI, and heart rate also. That's the vital signs. The BMI helped to kind of understand about the bariatric surgery, and on the other pressure findings led to the medical condition. Perspective of an MSN prepared nurse. An MSN prepared nurse would have offered patient-centered care in such a scenario. The approach would involve respecting the patient's belief, values, and care traditions. As an MSN nurse, the author would have inquired about the author's wishes and beliefs. Afterwards, they would have integrated them in the healthcare delivery. Moreover, an MSN prepared nurse have recommended evidence-based practice to help the patient manage his weight alongside bariatric surgery. MSN nursing champions and evidence-based care, and as an MSN nurse, the author will have recommended practice such as brisk walk and proper nutrition for the weight management. An MSN nurse would also have used supportive tools such as health in illness to help patient care achieve their optimal wellness. Impact of graduate level nursing education. Graduate education allowed the author to utilize the art of science of nursing during care delivery. The author used appropriate non-verbal cues such as wearing a smile to get the patient relaxed. Also, the author used the patient's objective and subjective and medical history to arrive at a proper diagnosis and recommend appropriate medical interventions. Graduate level education focuses on optimal care, such as the author attended to the patient's mental and the physical needs. Our conclusion: proper clinical judgment and effective decision making are essential to nursing practice. The art of nursing deals with compassion in care, while the science of nursing dwells on medical care. Merged, the two empower nurses to make effective healthcare decisions and clinical judgments. In the author's experience, they use an effective approach that allow for effective care delivery as per graduate level of education. An MSN nurse would have taken a different approach, leading to better results, holistic care, and better experience. And our last slide is on the references. Thank you.